Hello everyone. In today's session, we'll be discussing another important topic from pediatric nursing, that is chromosome disorders. So let's start. First is autosomal disorder. Okay. Down syndrome or trisomy 21 or Mongolism. ठीक है? Common is chromosomal disorder. Women at high risk of giving birth to a child with Down syndrome are those over age of 34 years. ओके सो बेसिकली इफ प्राइमरी पैरा या जो भी बोलो वो मम्मी का अगर एज ओवर एज है, मतलब मान लो 35 या 34 के ऊपर है, तो वो सब बच्चे का डाउन सिंड्रोम होने का चांस बहुत ज्यादा है. इट इज क्लियर नाउ. टाइप 3 known type of Down syndrome are trisomy 21, that is 95% of all cases. What is that? 3x chromosome at chromosomes number 21. So total number of chromosomes become 47 instead of 46. Okay. Now next one is translocation of 21 with 14. That is only 4% of all cases. So total number of chromosomes are 46, but one is large and atypical. Okay. Now coming to next one, mosaicism. What is that? That will be 1% of all cases, present of cells of two different genetic materials in the same individual. So two different genetic materials in the same individual. It occurs due to post-conceptional error in chromosomal division during mitosis. So post-conceptional error in chromosomal division during mitosis. Okay. Now what will be the clinical manifestation? So child have look like Mongolian race, example Chinese, Tibetans and Japanese. We have already seen this kind of people, like Chinese drama is there, एंड जापान में क्या है, कोरिया का मान लो, वो भी सेम दिखते हैं. तो ऐसे देखेंगे जो बच्चा होगा ना, वो चाइल्ड हैव लुक लाइक अ मंगोलियन रेस. ओके. देन व्हाट विल बी द फीचर्स? स्मॉल हेड और माइक्रोसेफेली विथ फ्लैट ऑक्सीपुट. ओके. ऑक्सीपुट पीछे है, देखो हेड का पीछे जो हमारा प्रोट्रूशन एक दिखता है ना, वो है हमारा ऑक्सीपुट. सो दैट विल बी फ्लैट इन दोस चाइल्ड. देन स्मॉल टीथ एंड प्रोट्रूडिंग टंग. ओके. दांत छोटे छोटे होगा और जो टांग है वो बाहर निकल रहेगा, मतलब प्रोट्रूडिंग मतलब वो ऑल टाइम, मतलब कभी कभी क्या है ना, अनकॉन्शियसली वो बाहर आ जाता है. देन स्लोपिंग फोरहेड अलोंग लो सेट ईयर्स विथ स्मॉल कैनल्स. ओके. जो फोरहेड होगा उसके साथ अलोंग विथ लो सेट होगा, मतलब जो ईयर्स का लेवल है हमारा वो उसका नीचे हो जाएगा थोड़ा. देन फ्लैट फेस एंड नेशल ब्रिज एंड पैल्पेब्रल आईलिड फिशर. ठीक है. सो आईलिड फिशर दिखा जाएगा. देन शॉर्ट एंड ब्रॉड हैंड विथ सिंगल ट्रांसवर्स पाल्मर क्रीज. ओके. मतलब क्या होगा, सिंगल, मतलब जो पाल्मर क्रीज है ना वो सिंगल लाइन में होगा, उसको बोलते हैं सिमियन क्रीजेस. देन ब्रैकिडक्टाइलिया. व्हाट इज दैट? एबनॉर्मल शॉर्टनेस ऑफ द फिंगर्स एंड टोज. ओके. सो दैट विल बी एबनॉर्मल वन. नाउ clinodactyly, that is hypoplasia of middle phalanx of one or more fingers resulting in inward curving of these fingers. Okay. So that will be basically more than 5 fingers. Okay. That is clinodactyly. मान लो वो जो बच्चा है उसको 6 और 7 नंबर का फिंगर्स है. Then large gap between first big toe and second toe of feet called sandal gap. When we are wearing sandal na, that time we need a gap, we are putting that barrier in between first two toes, so that's why it is called sandal gap. Associated congenital heart disease like valvular disease are common, that is 40%. Other associated disorder like Alzheimer like changes in brain, Hirschsprung disease, then visual and hearing defect. All these symptoms will be seen. Now coming to Edwards syndrome or trisomy 18, a severe lethal developmental disorder in which a third copy of chromosome 18 is present in the cell nucleus. Okay. Children with trisomy 18 usually do not survive beyond the first year of life. They don't survive, मतलब वो बच्चा बस 1 साल के लिए जिंदा रहता है. What will be the clinical manifestation? Developmental retardation, elongated skull, low set and malformed ears, micrognathia, abnormal smallness of jaws, then especially the lower jaw. The lower jaw will be abnormally small. Then short sternum, shield-shaped chest. Okay. Now next is Patau syndrome. Then what is that? A severe developmental disorder in which a third copy of chromosome 13 is present in the cell nucleus. Then sex chromosome disorder, that is Turner syndrome, described by Henry Turner, US physician. It also known as gonadal dysgenesis. Okay, a congenital endocrine disorder caused by a failure of the ovaries to respond to the pituitary hormone. That is gonadotropin stimulation. ठीक है. Second sex X chromosome are absent in female 45X0. Affected female have amenorrhea, failure of sexual maturation, and usually short stature. Then Klinefelter syndrome, described by Harry Klinefelter, US physician. 47XXY, 1 extra X chromosomes in newborn male. Then most common sex chromosome syndrome marked by primary testicular failure. Okay, affected male have small firm testes, then gynecomastia, then abnormally long legs and infertility. Then what is gynecomastia? That will be like female breast that will be present in male. So that is the gynecomastia. So all these are chromosomal disorder that will be seen in children. So hope all these points are clear to all of you. See you in next video. Thank you.